Hey everyone, welcome back to my channel. My name is Kelly and I'm a physical therapist and I specialize in oncology and lymphedema. Today in this video we're going to go through how you can reduce and manage swelling or lymphedema in your breast or chest wall. So many people have seen or heard that you get lymphedema in your arm after breast cancer surgery or you're at risk for it. But why do you get lymphedema or swelling in your breast or your chest? It's for the same reason. Your lymphatic vessels run from your breast or your chest wall to your armpits to then get out towards the heart and get disposed of. But when you have less lymph nodes in your armpit, the system gets backed up. The fluid has to flow through, but with less lymph nodes there to filter through, the system will then drain backwards and fill up, causing the swelling or causing the increase in size. The number of lymph nodes removed does play a role in your risk of getting lymphedema. For those of you who have 20 to 40 of lymph nodes removed, you are at a higher risk compared to someone who's maybe only had 2 lymph nodes removed from their armpit. I'm going to go through the 5 ways we can help reduce your swelling or your lymphedema in your breast and chest wall. So one of the best things you can do for your breast or for your chest wall to reduce your swelling is getting compression on that. Just like we would for someone's legs or arm that has swelling or has lymphedema, we would put compression stocking or compression sleeve on them. We also want to try to get some compression on your chest. That can come in a couple different forms. Number 1, the most common is a compression bra. It's similar to a sports bra. It has very full coverage. You'll see likely wider straps, and you want to make sure it has a wider side on the side of your chest. That will give you a lot of coverage to put compression and put pressure onto that area that is swollen to help shrink it. They do make specialized compression bras either at a specialty vendor store, online, or sometimes even a departmental store like Macy's or Nordstrom's will have them as well. The other option will be a compression tank top or another item similar. So think of Spanx that someone would wear for their lower body. In that similar version, they make shapewear or compression wear for the upper body as well. You can even get these at a local store like Target, but they do make custom ones if needed. You just want to make sure that with your compression bra and tanks, anything that you're wearing, that you don't have the underwire with them, that they are pretty flat, so you don't get any cut off or tourniqueted areas. That will likely make your swelling even worse. The second thing we do is another type of compression. It is a sort of a swell spot or a Jovi pack. I have made another video on how to make one of these and I'll link that down below. But essentially a swell spot is a small little pillow or cushion that we put inside a compression bra or a tank top that will hold it in place, and that'll give a little bit more compression to the chest in whatever area that you have swelling. They do make them for the breast, they make them for the side, and they even make it to wrap around towards the back. Depending on where you're swelling, you can adapt or pick the one that fits you. The swell spot will also have little pieces of chip foams that when it goes against the skin, it will help break up that fibrotic or thickened tissue that some may have. That can also help improve lymphatic flow and help reduce your swelling. So the third thing that's going to be helpful for your lymphedema or your swelling in your breast or chest wall is manual lymph drainage. Now I have made videos of manual lymph drainage for various parts of the body, and I'll include the breast one down below. But what it is, it's a gentle massage that helps move the fluid from an area that is swollen or backed up and encourage it to move along to an area that has better lymph nodes or more lymph nodes to help drain out. Manual lymph drainage can be done by a certified lymphedema therapist, or they may teach you how to do it on your own. It's typically not enough to use by itself to manage your swelling, however, it is nice in conjunction with the compression. The fourth thing that can be helpful is to reduce your scar tissue or your radiation fibrosis. For those of you who have had radiation, you may have that thickened tissue, which we call fibrosis, and that can come on soon after radiation or even a year plus out. You may also have thickened tissue or feel thickened tissue around your surgical sites, which is likely scar tissue. When you have that thicker area, the fluid can't move through because it blocks the pathways. So what we try to do is some manual techniques or myofascial release techniques to those areas to soften them. And when we break up some of that scar tissue or some of that fibrosis, then the fluid has an easier time moving through, and that can help reduce your swelling. The fifth thing you can do to help reduce your swelling or lymphedema in your breast is movement. Exercise is one of the best ways to get muscle activation in your body. The muscle activation causes a natural pump in the system, which can boost your lymphatic system to work harder and get the fluid moving out of that area. Find something that you enjoy doing and try to get a little bit of exercise in each day. Breast or chest wall lymphedema or swelling can be caused by a couple different things. Sometimes it's short term, and sometimes unfortunately it is lifelong. Work with your certified lymphedema therapist to find a program that fits you best so you can help manage your lymphedema in your breast or chest wall and reduce your risk of getting other complications such as infection. Thanks everyone.